All right. Today I have with me one of my favorite people in the whole world. We met when she was actually a student and I was the president at Palmer. And she was in the Vote Leadership Society, which was a really unique, exclusive group of students that were on scholarship actually because of their expertise and especially because of their leadership skills. So, and that's played out. It was money well spent, I would think, from Palmer's standpoint. Because
Yeah.
you taught at Life West for a long period of time, and but you bring a really unique perspective, and you were one of our core experts in putting MLiQ together, especially the section on vital health, which is turning out to be for chiropractors the most interesting section because it's asking questions and dealing with issues that heretofore chiropractors kind of only found out roundabout with a patient if they brought something up. So, you want to give us a quick background on the whole functional aspect of vital health and why it's so critical?
Yeah. I mean, for us as chiropractors, one of the things, that we are constantly talking about is while people may come in with pain, how do we have a conversation about health and it being their responsibility? And so when we look at something like vital health, it's a key critical factor because we're really looking at people's quality of life. And so, how they feel about their health dictates how they take care of it. And so while we recognize and we know that through chiropractic care, people will see changes and shifts in how they're physically feeling, we are constantly challenged by, and then what? And then how do I introduce concepts of wellness and overall vitality into the conversation that I'm wanting to have, but maybe not having or not having a venue to meet a patient where they're at from that perspective.
Yeah, and the trickle down from that is patients only come as long as they have vision to come. Like if their vision for chiropractic is neck and back pain, then they're out the door when neck and back pain's taken care of. If their vision is this is my life and this is part of my lifestyle and
Mhm.
this is part of a different approach than the classic medical approach, then they're going to come in not only more but probably for a lifetime with their family and refer people for different reasons. So there's also a pragmatic aspect to that.
Mhm.
One of the things that you made me aware of when we started talking about this is that in functional medicine, there are six precursors to disease.
Mhm.
And my ears perked up when you said that because we've always talked about prevention in chiropractic, but
Mhm.
prevention boiled down to, well, just keep coming in and we'll see you a couple times a month.
Right.
This is a whole different approach. Talk to me about those six precursors.
Sure. So, the model of functional medicine has really existed since the early 2000s, but it's really been put on the map, and I would say by people like Dr. Mark Hyman, who has really done an amazing job of communicating that, when we look at our patient base and they come in, that there's multi factors that are playing out in why they're feeling the way that they're feeling. And so, a diagnosis isn't just what's happening with the patient. We have to look deeper than that. We have to look at what are the other factors that are playing out. So we talk about the pillars, and those individual pillars look at all the different components of somebody's health. And so we recognize that, where they are mentally, emotionally, spiritually is going to absolutely impact their health. We look at items like their cardiometabolic profile and how they're taking care of their body through exercise, through nutrition. And then we also recognize that we're living in a world that is, a lot dirtier than it used to be. And so, we look at detox not from a addictions perspective, but we look at it from a perspective of there's not a human being on this planet that doesn't in some way when we test have styrofoam in their tissue. And so the reality is that the air we breathe is not as clean, the soil that we're consuming our fruit, our vegetables in is not as clean, and so our body is taking on toxins, and we'd be foolish to not acknowledge that that plays a role in how somebody's body expresses. So it impacts our hormones, what that actually looks like. So the pillars are really built off of the idea that it's not just one aspect of health expression, it's the pillars and the aspects that ultimately play out. Do you exercise? What's your diet like? What's your environment like, both internally and externally? And then we can't ignore, the role that chiropractors play when we talk about lifestyle choices in all of those domains, but also the nature of what we do from a nervous system perspective is that the nervous system, the musculoskeletal system intimately is a pillar and has been always in functional medicine. So we want the ability to be able to acknowledge that each one of those things impact our patients. And it's our responsibility when we take a case history to have a sense of how is that playing out in this person as they present to me today.
Yeah, so I know that for those that haven't seen or been into the app or haven't been introduced to it, this first section on Vital Health, a patient has to fill this out before they can get into the app and start playing around with the other areas of brain health and nutrition and happiness index and movement and those kinds of things. And I know that you and Dr. Finsky designed 10 questions in each of these 6 areas.
Right.
So there's 60 questions. And, just again, for people that haven't been in it, one of the questions, in it is about belly fat. One of the things that always surprised me when I read it was that the number one, or at least one of the major predictors of Alzheimer's in men especially, is belly fat in midlife. And if a chiropractor can allow a patient to be aware of that and handle it now rather than when they're 75 and they're starting to shake and lose their memory, what a great gift it is for patients.
Yeah, absolutely. And we also recognize that, what happens with, fat doesn't mean unhealthy. And we have as many skinny fat people whose body constitution is unhealthy. I mean, we have children who have fatty livers because of what's happening in our nutritional stream. We have fat, that we recognize is an indicator and plays out as a factor of consideration with things like Alzheimer's. And so I think it's really important to be able to have an open dialogue that fat doesn't mean unhealthy and that skinny doesn't mean healthy. And, those are important factors.
Yeah. What would you say to the chiropractor that says, I don't deal with any of that?
Right.
Right. Yeah. I don't want to deal with that.
Yeah. And I think that it's okay if you choose to not take action in those areas, but you want to recognize and refer. So you still get to decide what your scope is, but knowing who's presenting on your table and understanding all of the factors that play out and why they're feeling every day remains your responsibility.
Absolutely. And I would say impacts what you're doing with the impacts your adjustments, right?
100%.
And how well the patient responds to care, which, if they understand this and can handle, and that's not the only issue of those 60 questions, but if they can begin to handle some of those that are maybe even less traumatic than some of those things, all of a sudden their care, they start responding better. My father, of course, was a chiropractor. They didn't have a generation of people coming in to see them where the average person was taking 5 or 6 drugs, 100%. And considered it normal, right, to be taking that many drugs. And so, my father's day, they would adjust a patient and they would see phenomenal results immediately. And today, there's so much pollution in people's bodies and their lifestyles are so pathetic that even while we're adjusting, sometimes it's hard to see the miracles.
100%. And that's why, you don't have to be the person to do or place your patient on a detox protocol, or you don't have to offer some cleansing, but you do want to recognize that that's actually a significant factor that's not allowing full health expression in the patient, and know that you want to have somebody in your community that you can work with that can facilitate that kind of component of your patient's health. And that doesn't take them away from chiropractic. It actually does, as you say, significantly improve the patient's outcome when you acknowledge that these are the things that are playing out.
When you were at Palmer, we were building a new building, and the architect we had was from Wisconsin, and his wife came down with a really serious life-threatening condition. It wasn't acute, Wasn't like she was going to pass away in 3 months, but
Right.
she had to deal with it and decided not to deal with it in the normal medical route. So first she went to a naturopath, and the naturopath cleaned up a lot of her diet. Along the way, the naturopath said, you ought to see a chiropractor.
Yeah.
So she didn't stop seeing the naturopath. She added chiropractic to it. Along the way, the chiropractor recommended you should get some massage care. And so over a period of 2 years, she handled the problem, but she built her own team. But it took her 2 years to do it. When you go into a hospital, the team is all sitting there. They just refer you from room to room.
Right.
And so, this whole notion that we could put a team together that has a chiropractic philosophy and a more naturalistic, organic lifestyle, I think is critically important for patients.
I think it's really important, to think about it in terms of screening and educating. And I think that that's what MyLifeIQ actually really does, is makes you aware of those other factors that, that maybe you haven't fully explored, but also, in that model of chiropractic that we've had for decades and decades, which has been very high touch and low tech, our patients aren't low tech anymore.
Right.
And, we know that they are, for as many of us 20 years ago in school, we were taught people are Googling their health.
Right.
And I say to the younger students and young docs that I'm working with, it's yes. And the generation of the practices you're going in and associating with will say, yes, they'll still say patients are Googling their health. And I say, and do you know of a Dr. Google for chiropractors? There's no Google chiropractor.
Right.
And the reality is that the way we see health, the way we recognize and take responsibility has the potential of being high tech and high touch, which when we talk about critical core, things we need as human beings is we need connection. And so it keeps us connected to our patients in a meaningful way through technology that doesn't take them away from our practice, but actually connects them to our philosophy. I think that's one of the most powerful things about this app.
Yeah, and that was one of its primary intentions when we started. I read the other day, it was CNBC, 5 years ago, there were 350,000 visits to medical doctors that were televisits, virtual visits. They're estimating that this year there'll be over 1 billion.
Yeah.
So people want their health care 24/7. They want access. They want to feel connected, and they want to feel like their doctor understands more about them than just what they see on that visit when they walk in.
100%. And I think chiropractors, because we've existed in a model that's brick and mortar, are now feeling and experiencing a lack of connection when, patients have the masks and when visits are spaced out in a way that, because people are hesitant to be there. It's time for us to step up and step into the direction that health is taking us and being proactive about us maintaining that level of connection and accessibility with our patients in a way that the older model is just not going to do for us.
Yeah. And that's probably a great way to end. It's said more eloquently than I would say it, but chiropractors ought to be getting reimbursed and acknowledged for their knowledge and their philosophy, not just for the technique of standing over a table thrusting. As much of a miracle as that is, chiropractors also are handing out a lot of knowledge day in and day out and need to hand out more. And it's as valuable as the adjustment is in affecting people's lives.
Yeah,
so
we want to position ourselves to be that go-to person to empower people to take better care of themselves.
Absolutely. As someone said to me recently, chiropractors should become the CWOs, the Chief Wellness Officers.
100%.
Yeah. Thanks, Tamara. It's so appreciated. And I love seeing you. And
thank you so much.
Hopefully in person soon.
Yes, I hope so.
Thanks.